Doctors often advise people with diabetes to cut down on sugar and take their medications correctly, but rarely do they explain the critical role of micronutrition, especially vitamins. A deficiency in key vitamins can quietly impair insulin function, weaken nerves, and accelerate complications. Yet most people with diabetes are completely unaware. Symptoms like chronic fatigue, aches and pains, and poor blood sugar control may actually be signs of important micronutrient deficiencies. 1. Vitamin B6, the silent essential for people with diabetes. Not many people think of vitamin B6 when it comes to diabetes, but in truth, it's one of the fastest depleted nutrients in people with high blood sugar. When glucose levels rise, the kidneys flush out excess sugar and, along with it, vitamin B6. At the same time, chronic inflammation and oxidative stress, both common in diabetes, cause the body to burn through B6 in its attempt to repair damaged tissues. To make matters worse, elevated insulin levels and medications like metformin or blood pressure drugs can further disrupt B6 metabolism or drain your body's storage. The result: many people with diabetes have a B6 deficiency without realizing it. Signs to watch for: if you often feel tired, mentally foggy or irritable, these could be early signs. B6 deficiency can also cause nerve issues like tingling, burning, muscle weakness, or poor coordination. You may experience dry skin, mouth sores, or frequent infections due to lowered immunity. In more severe cases, anemia may occur, showing up as dizziness, pale skin, or shortness of breath. How it affects your body. B6 is vital for the health of your nervous system, kidneys, eyes, and cardiovascular system. Without it, nerve damage progresses faster, and homocysteine levels rise, a major risk factor for hardened arteries and high blood pressure. Vision can also worsen more quickly, especially in diabetic retinopathy. Food sources: chickpeas, beef liver, wild salmon, turkey, and sunflower seeds are rich in B6. Try dishes like miso-glazed salmon with chickpeas, grilled beef liver with potatoes, or a hearty lamb stew with chickpeas to enjoy both flavor and natural nourishment. If your diet is lacking, consider a supplement. The best absorbed form is P5P pyridoxal 5-phosphate, commonly taken at 25 to 50 milligrams per day. However, always check with your doctor before taking high doses. Keep in mind, white carbs, sugar, alcohol, and certain medications can deplete B6, so maintaining a diverse, balanced diet, along with regular checkups, is a powerful step toward better long-term health with diabetes. 2. Vitamin E, the cellular shield for those living with diabetes. Vitamin E is often overlooked in everyday diets. Yet for those with diabetes, it acts like a silent hero, guarding the body against the hidden damage caused by high blood sugar. When glucose rises, oxidative stress increases. And this is where vitamin E steps in. A powerful antioxidant that neutralizes free radicals and protects cell membranes in vital organs like the heart, eyes, nerves, and kidneys. But there's a catch. Vitamin E needs healthy fats for absorption, and people with diabetes often suffer from impaired fat metabolism, reducing absorption. That's why many with diabetes are deficient in vitamin E and don't even know it. Signs of vitamin E deficiency: you may notice muscle weakness, poor coordination, or worsening nerve pain, such as tingling or burning in the limbs. Your skin may become dry, your eyesight may decline, and you might get sick more often due to a weakened immune system. How it impacts the body. Reproductive health. Vitamin E supports sperm quality in men and helps regulate female hormones. Deficiency can cause menstrual issues or reduced fertility. Nervous and circulatory systems. Low vitamin E increases the risk of nerve damage and speeds up diabetic neuropathy. Heart health. Deficiency contributes to arterial stiffness, high blood pressure, and higher stroke risk. At the cellular level, vitamin E reduces inflammation, strengthens membranes, and improves insulin sensitivity, helping stabilize blood sugar levels. Best food sources of vitamin E: sunflower seeds, almonds, hazelnuts, spinach, and avocados are excellent sources. Try meals like almond-crusted grilled fish, duck breast with hazelnut sauce, or avocado tartare with sunflower seeds and truffle oil. Delicious and naturally rich in E. Supplements: opt for natural vitamin E. D-alpha tocopherol, which is absorbed better than synthetic versions. A safe daily dose is 200 to 400 IU, but avoid overdosing, as excess vitamin E may thin the blood. What depletes vitamin E? Refined vegetable oils, fried foods, sugar, alcohol, and low-fat diets can all reduce absorption and increase loss. Overcooking vegetables also destroys much of their already limited vitamin E content. Getting enough vitamin E not only helps you manage diabetes more effectively, but it also protects your nerves, blood vessels, and immune system, vital defenses as we age. Consider it a non-negotiable ally in your journey toward healthy, empowered living after 60.3. Vitamin D, the sunshine hormone that improves insulin and protects blood vessels. I still remember Mr. Mike, a 67-year-old gentleman from Ohio. He was incredibly disciplined with his diabetes management, eating well, walking daily, and taking his medications faithfully. Yet strangely, his blood sugar remained unpredictable. Eventually we checked his vitamin D levels and they were extremely low. After proper supplementation, something amazing happened. Not only did his blood sugar stabilize, but his mood, sleep, and even blood pressure improved significantly. Why people with diabetes are often low in vitamin D. After age 60, the ability to synthesize vitamin D from sunlight declines sharply due to thinner skin and reduced time spent outdoors. Many older adults are also overweight, which traps vitamin D in fat tissue, making it less available to the body. On top of that, low dietary intake of vitamin D-rich foods like fatty fish, eggs, or sun-exposed mushrooms only worsens the deficiency. The vital roles of vitamin D improves insulin sensitivity, helping the body manage blood sugar more effectively. Chronic inflammation, a key feature of type 2 diabetes, protects blood vessels and the heart, lowering risks of atherosclerosis, stroke, and high blood pressure. Supports nerve health, slowing the progression of diabetic neuropathy, mood, and improves sleep. Through its role in serotonin production. Signs of vitamin D deficiency. Many people have no clear symptoms but watch for chronic fatigue, vague joint or bone pain, unstable blood sugar, frequent colds or respiratory infections, muscle aches, or feeling unsteady on your feet. A blood test for 25-OD is the best way to confirm deficiency. Foods that help restore vitamin D. Fatty fish like wild salmon, mackerel, sardines, egg yolks, beef liver, sun-dried mushrooms like manteiga or shiitake, fortified dairy products and cereals. Meal ideas: pansered salmon with steamed mushrooms and kale, or boiled eggs with lentils and roasted vegetables, both delicious and full of natural vitamin D. Supplementing smartly. The best form is vitamin D3 cholecalciferol, typically taken at 1,000–2,000 IU day, depending on the degree of deficiency. Regular testing is recommended, with ideal blood levels between 30 to 50 ng per milliliter. Factors that interfere with absorption: low sunlight exposure, long-term use of corticosteroids, statins, intestinal disorders like IBD or celiac disease, and obesity. can all reduce absorption or availability of vitamin D. Vitamin D isn't just a vitamin, it functions more like a hormone, influencing your metabolism, immune system, and emotional well-being. For those over 60 living with diabetes, correcting a deficiency can make a real difference in preventing complications and living a healthier, more vibrant life. For vitamin C, the silent shield against diabetes complications. Vitamin C isn't just something you reach for when you're catching a cold. For people living with diabetes, it's a crucial antioxidant that helps defend your cells from damage caused by high blood sugar. Unfortunately, many people with diabetes are unknowingly deficient in vitamin C. Why does this happen? Vitamin C and glucose compete to enter cells, so when blood sugar is high, glucose wins, and vitamin C absorption drops. Also, people with diabetes urinate more, flushing out water-soluble vitamin C. Meanwhile, the body is under oxidative stress and needs more vitamin C than ever for repair. Signs of deficiency: you may feel tired, bruises heal slowly, or experience bleeding, gums. Your skin might feel dry or flaky, and joints may ache. In severe cases, symptoms like dizziness, anemia, or pale skin may appear, though few realize these are linked to low vitamin C. Effects on major organs. Reproductive health protects sperm and eggs from free radical damage nerves and kidneys. Deficiency worsens diabetic neuropathy and kidney function decline. Eyes helps protect tiny blood vessels in the retina and prevent vision loss. Heart keeps arteries flexible, reduces inflammation, and prevents plaque buildup at the cellular level. Boosts collagen, regenerates vitamin A, strengthens the immune system, and slows cell aging. Vitamin C-rich foods: cacao plum, the richest source; acerola cherry, red bell peppers, kiwi, strawberry. Suggested meals: tropical fruit ceviche, fish tartare with kiwi sauce, or acerola sorbet with dark chocolate. Tasty and nourishing. Smart supplementation: the most absorbable form is liposomal vitamin C. Typical dose: 500 to 1000 milligrams per day. During illness or high stress, higher doses may be needed, but consult your doctor. What depletes vitamin C? High sugar intake, alcohol, smoking, overcooking vegetables, and ultra-processed foods can all drain your body's vitamin C stores quickly. The small vitamin C plays a huge role in protecting your heart, eyes, nerves, and immune system, all crucial front lines for people with diabetes. Getting enough every day gives your body a powerful, lasting shield to stay healthy and strong. Final thoughts: vitamins B6, E, D, and C are essential for managing diabetes and preventing complications. Deficiency in any of them can impair insulin, weaken nerves, and strain the heart, eyes, and kidneys. The right mix of foods or supplements, when necessary, can make a life-changing difference in diabetes. Care if today's video helped you or someone you care about understand diabetes a little better. I'd truly appreciate your support. Please hit subscribe, tap the like button, and feel free to share this video with your friends or family. It might just be the health gift they didn't know they needed. This channel wasn't created to preach or give orders, just to offer a gentle space where we can understand our bodies, embrace aging, and live healthier, happier lives together. Thank you so much for listening. I look forward to seeing you again in the next video.